Hello and welcome to equine herpes virus, respiratory and neurologic syndromes. Equine herpes virus is everywhere in the horse population. Most horses encounter the virus when they are young horses, and then the virus remains latent, hidden within the horse for the rest of its life. And at times of stress, any horse can start shedding virus. And so that makes it a particularly difficult virus to deal with, and it can cause, obviously, life-threatening disease. There are four syndromes that are typically associated with EHV are respiratory, abortion, neonatal foal death, and neurologic disease, which is known as equine herpes myeloencephalopathy. We're going to focus on the first and the fourth of these, the respiratory and neurologic syndrome. Respiratory disease, what to look out for. These horses tend to have a fever, a high temperature, coughing, nasal discharge, a snotty nose. Contrast to neurologic disease, we see incoordination of particularly the hind legs and occasionally the forelegs. We see the horse inability to urinate and or dribbling of urine. This can present as mild colic. We see bladder weakness. We see horses that are unable to get up, as what we would call recumbent horses. And these neurologic signs are usually preceded by fever and or respiratory signs a few days, if not a week or two, prior to development of neurologic disease. How is the virus spread? The most common way of the virus spreading is through aerosol, inhalation of droplets from coughing and snorting. Shedding can typically last 7 to 10 days, but in a small number of cases that can persist longer than that time period. And therefore, a 28-day isolation period is recommended after diagnosis, or active screening for shedding of the virus through nasopharyngeal swabs and PCR, and typically from day 14 onwards to document the cessation, i.e. the stopping of viral shedding. Indirect transmission of the virus is possible. Fomites, so objects that can carry the virus. The virus can live in the environment for a couple of weeks. And fomites would include people, tack, yard equipment, can pass the virus between horses. What to do if we suspect a case? We must seek immediate veterinary attention and cease all movements on and off the yard. To go in further details beyond the scope of this recording, but I think it's important to discuss how we reduce the risk of EHV. So as we said, this is a latent virus, and stress often causes horses to shed virus, and this includes travelling and mixing of horses, which are both inherent to attending horse gatherings. So we must ensure that the events that we go to are well organised to reduce the stress, controlling horse flow, minimising mixing, appropriate class sizes, and providing adequate space for parking, stabling and warm-up. The goals of control measures are to reduce the likelihood of reactivation, limit the direct and indirect spread between horses at gatherings, and reduce the likelihood that infected horses will attend gatherings. Promote information sharing, enhance monitoring and early diagnosis via a reporting strategy. Vaccination for an endemic, i.e. virus that we have in the country within our population of horses all the time, and one that is latent in so many, is absolutely key to prevention. However, vaccination isn't an absolute protection for horses, and all it does is reduce the amount of virus that a particular horse shed. It doesn't actually prevent neurologic disease, so it has to be used in tandem with good biosecurity and at targeted horses at a higher risk. So the Equine Infectious Disease Group would advise that horses less than 5 years of age but more than 6 months should be vaccinated, horses that may come into contact with pregnant mares, horses that are housed at facilities with frequent movements of horses on and off the premises, and horses which frequently attend gatherings where horses mingle in close proximity. And as I said, and to reiterate, with good biosecurity, vaccination can decrease the risk of equine herpes, but cannot take that risk away, and does not directly prevent, at this moment in time, neurologic disease of EHV, and must be used to decrease the amount of virus in the environment, and therefore hopefully lessen the number of cases that we see of neurologic disease by that mechanism in tandem with good biosecurity.